My name is Lawrence Doon. I'm 72 years old, and I'm retired from the railroad. Retirement is, in my personal opinion, you're so much busier than you are when you're working. When it came to my prostate problems, I didn't think there was anything wrong until they did a scan and found it. Nothing actually hurt. I wake up most days feeling, really good. Right during the middle of COVID, a fellow that I worked with for about 40 years, he was in the hospital. They were treating him with radiation and different things, and he fought it for about 2 years and finally passed away. So, but when they tell you you've got something, you need to take action on it instead of, dragging your feet and putting it off. They always tell you and believe sincerely that they got it all, but you never know until you go back, and you should follow up. It's really important, I think. How you doing, doctor?
Good. The star is here.
No, the star is lost.
The star is lost.
He went to see, finally, a urologist because our nurse practitioner, she was the last one, of course, that had done a PSA. And so I started doing my research and due diligence, and I decided on Dr. Baylor. And as it turned out, I picked a really good one, so.
With his cancer recurrence, based off of the PSA, the next question, of course, is where is it? And what treatment should we do? When should that treatment be started? What are the side effects? So with Illuccix enabling us to see the specific site of recurrence, now we can more confidently recommend a treatment.
We're going to have you put your head right here, sir, feet down there.
Okay.
One of our radiologists said it's kind of like turning on a light bulb compared to conventional imaging.
Tracers, and I'm going to give you a little more saline, wipe off your IV, and you just keep holding still.
With a PET agent that's molecularly targeted to a cancer receptor, it's a whole new day and all the staging paradigms will change. Now the questions will be, how do we adjust treatments? How do we adjust our standard paradigms for treatment?
No problem. I can lay down and do nothing anytime. You don't feel a thing. It's easy as laying down on your bed. I've never been first at receiving anything. Maybe an F on my report card at one time or another, but it's an honor for me, and I just hope it helps anybody that needs to have the same type of surgery and the same type of scan to find that bad spot in them and get it taken care of.
Each cancer is unique and different. With prostate, one of the differentiating factors is it tends to have an infiltrating pattern of growth, and that means it spreads between and amongst normal prostate cancer tissue. So it makes it very hard to image.
Traditionally, the imaging technologies that have been available in radiology have not been very successful in finding the location of disease that you know from their blood test must be present.
If you think of kidney cancer or bladder cancer, you see a spherical cancer lesion and it makes that easy to biopsy. But with prostate cancer, with its infiltrating pattern of growth, it's hard to see it on conventional imaging.
I think the PSMA targeted PET really has been a major advance, and if the clinician knows where the tumor has recurred, it better empowers their treatment decisions for how to best manage that patient's case.
This place gives you a very comfortable feeling. I mean, I've never felt nervous here. It's just like everybody's so nice.
Clearly, nobody wants to have prostate cancer, but if you're going to have prostate cancer, there's no better time to have it than today. The tools available now for diagnosing the disease and planning treatment are as good as they've ever been and are well beyond what was possible even 5 years ago. The exciting thing about the Telix product launch really is that this now brings this technology to the whole nation, so patients across the country will have routine access to technology for better defining the location and extent of their disease.
To make those quality of life decisions, what to spare, what to preserve, or whether to take a wide margin in order to get negative margins. Of course, knowing precisely where the cancer is and the tumor boundaries is critical.
The fact that he can be a part of this whole thing and do something that's going to maybe help other people in the future, put them at ease, let them know that there are other things out there for them to do. I feel very excited. I really do. I'm hoping for a really good result.
Get it. It doesn't hurt. It's not going to change your life any to know what's right and wrong with you. So I would suggest that everybody get it. Definitely. If it's available to you, go. I'll even come with you if you want.
Indications and usage. Illucix, after radiolabeling with gallium-68, is a radioactive diagnostic agent indicated for positron emission tomography, PET, of prostate-specific membrane antigen, PSMA, positive lesions in men with prostate cancer. With suspected metastasis who are candidates for initial definitive therapy, with suspected recurrence based on elevated serum prostate-specific antigen PSA level. Important safety information. Warnings and precautions. Risk for misdiagnosis. Image interpretation errors can occur with gallium-68 gazettatide, PET. A negative image does not rule out the presence of prostate cancer, and a positive image does not confirm the presence of prostate cancer. Gallium-68 gazettatide uptake is not specific for prostate cancer and may occur with other types of cancer, as well as non-malignant processes such as Paget's disease, fibrous dysplasia, and osteophytosis. Clinical correlation, which may include histopathological evaluation of the suspected prostate cancer site, is recommended. Radiation risks. Gallium-68 gazettatide contributes to a patient's overall long-term cumulative radiation exposure. Long-term cumulative radiation exposure is associated with an increased risk for cancer. Ensure safe handling to minimize radiation exposure to the patient and healthcare workers. Advise patients to hydrate before and after administration and to void frequently after administration. Adverse reactions. The most commonly reported adverse reactions were nausea, diarrhea, and dizziness, occurring at a rate of less than 1%. Drug interactions. Androgen deprivation therapy, ADT, and other therapies targeting the androgen pathway, such as androgen receptor antagonists, can result in changes in uptake of gallium-68 gazettatide in prostate cancer. Please see full prescribing information at http://illuccixhcp.com/s/Illuccix-prescribing information.pdf.